Um, Thanks for being here. I think everybody can see all of us as we get started here. Just wanted to welcome everyone before we get started. Just one quick announcement about, there you are, Jean. Hi.
Hi.
One quick announcement about vote by mail. The election on July 7th is primarily vote by mail. Everybody should know this. All registered Democrats and Republicans in the state will receive a mail-in ballot, so you don't have to worry about the application. Postage will be on it, so you just have to complete it and return it. Registered voters who are not affiliated with a political party will receive an application to vote by mail, and they will have to fill that out and return it by June 30th if they wish to vote on the July 7th primary election. There will be at least one polling place per municipality that will be open on election day, and further details will be forthcoming from our Mercer County Board of Elections. And for those who have already applied to vote by mail, the earliest ballots will be mailed out in late May, early June. The deadline to register to vote in time for the July 7th primary is June 16th. That has not changed since the governor made his announcement. And as mentioned earlier, the final day to mail in an application to vote by mail, if you are unaffiliated, is June 30th. I'll be releasing this all in written material in an email message as well. So it's my pleasure to introduce first Liz Cohen this evening. She's the coordinator of tonight's discussion. She's an executive board member of the PCDO, a stellar community advocate, a campaigner, and a longtime member of the executive board. She's our current chair of the Advocacy Committee and past chair of the Programming Committee and Nominating Committees. And she really dedicates herself to education, resulting in political action and real community advocacy. It's a pleasure to work with Liz. She's a hospice social worker by day. She's also a high-performing municipal committee member for the Democratic Municipal Committee in Princeton, where she helps to get out the vote and has done that for a long time. She co-chairs the Reformed Jewish Voice of New Jersey, a state-level advocacy group, and also co-chaired the Reform Movement's National Immigrant Justice Campaign. Liz is going to introduce our speakers this evening. We're so happy to have you here, and she will be guiding the discussion. Thanks, Liz.
Thank you, Jean. Yes, and I'm not muted. So welcome to everyone who's taking the time to learn about this important issue of what's happening in our prisons in this time of COVID. We're really honored to have two wonderful speakers, advocates with us. You see Alexander Shalom. Alex is Senior Supervising Attorney and Director of the Supreme Court Advocacy at the ACLU New Jersey. Alex primarily litigates cases on issues that disproportionately impact people of color. He appears in trial and appellate courts throughout the state, seeking to ensure more accountable police practices, criminal justice and juvenile justice systems that are more just, better conditions for those in prisons and jails, and more. But you can see he's a great advocate, and in addition to his court work, he is involved with policy and advocacy to make a more fair and just prison system and New Jersey overall. And Jean Ross, whose name you see here, is an attorney who's had the privilege of working with and on behalf of people of all ages involuntarily confined in the toxic environments of psychiatric hospitals and prisons. As a public employee, she has worked in human service agencies for local, county, and state governments, and on public boards, commissions, and legislative, executive, and judicial work groups. Jean attempts to use her direct experiences with individuals and families to inform collaborative, systemic advocacy with grassroots organizations. She's committed to a collaborative and holistic model of law practice and to illuminating the barriers to justice in our struggling democracy. So you see, we have people who live and breathe this issue day and night, and we're grateful for you to take some time to enlighten us, to help us have an overview of what's happening in our criminal justice system how it's highlighted by COVID and what we can do. I wonder if you can each start with just a moment. I gave a little bit of bio, but if you can say a word about what you specifically are doing with prisoners and prisons and why it matters to you. Alex, you want to start?
Sure. So thank you, Liz, and thanks to everyone for having me. So as Liz said, I work at the ACLU of New Jersey, and I lead some of our work around at the Supreme Court, and I also do a lot of our work in various criminal justice spaces, including prisons and jails. And so if you had invited me here and the world wasn't blowing up all around us, I might have been having a conversation with you about mass incarceration and the ways in which New Jersey needs to confront its addiction to incarceration, and that our go-to response to basically everything that ails us is, well, let's create a punishment, let's create a mandatory punishment, let's lock people up for a long time, and that's proven totally ineffective. So if we were having that conversation, I would tell you that while I'm a New Jerseyan by birth and with a lot of pride, and I like to think that most of our social ills are the fault of Alabama or Texas, I would tell you that that's not true. And while it's true that the United States is the world's largest incarcerator, it's also true that if New Jersey were a country, it would be the 6th largest incarcerator by population, by a percentage of its population. And so we can't just blame our neighbors to the south or our neighbors to the west. We have to take some responsibility for cleaning our own house. And in fact, if you look at the prisons in New Jersey, they have the single worst black to white racial disparities in the country. So take a minute on that, what I just said, right? Our prisons are more racially segregated than Louisiana's, than Alabama's, than Mississippi's. So on a normal day, I would be telling you that that was a crisis, and that was a crisis that we needed to confront with the full force of our political might. But it's not a normal day. You're looking at my bedroom. If I could see your screens, I would be looking at your homes. We're in this unique time in this COVID-19 crisis. And unfortunately, while it's true that everyone can be stricken by this virus, and I think the best expression I heard is, it's not true that we're all in the same boat. We're all weathering the same storm, but we're in very different boats. And some of our friends are in rickety rowboats, while others of us have, protected yachts. And on choppy seas, that places us at very different risks of death. And so if you look at the pockets where this virus has hit hardest, there is a common theme. They're either meatpacking plants, which is slightly different, but has lots of economic injustice conversations you could have about it, or they're psychiatric hospitals, or they're old folks' homes, but mostly they're prisons and jails. And there too, the crisis is most acute in New Jersey. The death rate in our prisons in New Jersey is the worst in the country, the very worst in the country. In fact, we have more deaths in New Jersey than in 38 other states combined. And you can say, well, sure, but New Jersey's like in this geographic epicenter, so that makes sense. We also have more deaths than New York, Pennsylvania, Maryland, Delaware, Rhode Island, Massachusetts combined. So it's not just geography. We're doing something very, very wrong. And that's what I'm here to talk to you about today.
Thanks so much, Alex. Jean, can you introduce yourself and tell a bit about why this matters to you?
I'm going to be shorter than Alex, although I do want to add to what he said that Alex and I were responsible for drafting the legislation that made New Jersey the first state in the country to legislatively abolish the death penalty as an extra added attraction to all the other things he's been involved in.
Jean, could we see your face, please?
It will distract me if you don't mind. I have largely worked in the mental health system in New Jersey for many years. When I retired as a state worker and bureaucrat and lawyer, I began to follow many of my clients, I guess, from the mental health system into the prison system. So for the last almost 20 years, I have visited, written to, advocated on behalf of, and spent a lot of time on the phone with people in about 5 of the New Jersey prisons and members of their family. At this point, I am trying to help communicate to the people inside the prison that there are people outside who are very interested in what is happening to them. And so I am trying to bring things that are happening outside into the prisons and bring the voices of people in the prisons outside. And for a while, I was sending daily reports to the governor and leading legislators about what prisoners were telling me was happening. In the short outline that I sent to Liz just a little while ago, that perhaps some of you will, hopefully she will send to you after we have finished speaking. I started off with 2 quotes, which I'm not going to read. One of them is from a client of mine who says, just in part, I feel like I'm standing on the railroad tracks, staring down on an oncoming locomotive. I see it coming, but I'm unable to move, and I know I'm powerless to stop the train. I'm just bracing myself for the impact. That's from a person in East Jersey State Prison. And then I have one of my favorite quotes, which explains in part why I hope people who are here this evening have come to talk about these issues with us. It's a quote from Nicholas Katzenbach, our former neighbor in Princeton, and the former Chief Justice of the Third Circuit Court of Appeals, John Gibbons, which basically says, what happens in the prisons doesn't stay in the prisons, it comes out. Therefore, they say, we must create safe and productive conditions of confinement, not only because it is the right thing to do, but because it influences the safety, health, and prosperity of us all. So that's why I'm interested in what happens, particularly with this virus in the prisons. That's the end of my introduction.
Thanks so much, Jean. So while we are here in this specific moment, it'd be helpful to our listeners to really understand what the system looks like to start with. Alex, I wonder if you could just give a snapshot of what the components are of the system and some of the systemic inequalities and issues that we're facing.
Sure. So I think Jean can add to this. I'll try and be as brief as I can, but really we're talking about 2 types of institutions in large part. There's a third, but largely 2, which are prisons and jails. There are also immigration detention centers, which are kind of off to the side, and in New Jersey, 3 of the 4 places where immigrants are held in ICE custody are county jails. So let's start with the jails, and then we'll move to the prisons. There are, I believe now, 19 county jails. 2 of the county jails have closed, and they've consolidated with others. And in those facilities, where there are about 10,000 people held in the aggregate, slightly less now, there are largely 2 types of folks held. There's either people serving sentences, so anyone serving a sentence of 364 days or less would serve that sentence in the county jail. So that could be for a drug offense, it could be for a simple assault, it could be for driving while intoxicated, any number of a theft offense, any number of things could be served in the county jails. And then you also have people who are pretrial detainees, so people presumed innocent who are being held until their trial. It used to be that they would be held and there'd be a trial within a certain amount of time, but those time limits have been suspended as a result of COVID-19. So they're almost being held indefinitely. And I will say, while that's troubling and problematic, New Jersey has also reformed its pretrial system starting in 2014 and again, kind of effective in 2017. So we've actually dramatically reduced the number of people who are being incarcerated pretrial, but it's still a sizable number. So those are the people in our county jails spread out amongst 19 different counties. Then we have our state prison system. Our state prison system is a little more than 18,000 people at the beginning of this year, spread out in facilities. I don't think there are any north of Newark, and they go all the way down to Cumberland County. 3 different prisons in Cumberland County. There are maximum security prisons and medium security prisons and lower security prisons. There's also a series of halfway houses, which are run by the Department of Corrections, but where the employees are not Department of Corrections employees. And halfway houses are places largely where people transition from the prison system to our communities. That's not a hard and fast rule. There's some people who go to halfway houses for longer periods. There are also some people who never go to halfway houses at all, but that's that. And those are folks, some of whom are serving sentences for the same sorts of crimes that you heard about in the jails, and other people who are serving sentences for very serious crimes, for rapes and murders and kidnappings and all manner of things. And you can't ignore three critical facts, I'll say, about these prisons. The first is that despite work that advocates like Jean have done and others have done for years, they're still terrible places. The conditions in them are still absolutely horrific. The deprivation, the inhumanity is really significant. And we do maybe a better job than some other states, but it's on a scale of terrible to horrible. And so I don't know where we stand, but it's not great. The other is you can't ignore the gross racial disparities that plague the system. There's just no way to talk about prisons and our criminal legal system without talking about the racism that infects it. And so that infects it at every stage. So let's take marijuana, right? There aren't that many people serving prison sentences for marijuana, but marijuana is something that everyone can kind of get their head around, because we all know people who've smoked pot. And we also, some of us know people who've been arrested for pot and people who've been convicted for possessing pot. And we will know more of those people if our friends are Black, because we know that in New Jersey, even though Black people and white people smoke pot at virtually the exact same rate, Black people are arrested and convicted at 3 times the rate of white people. The data aren't as clear on other things, but we know that there are gross racial disparities in arrest procedures, in prosecution, in convictions, and in sentencing. So up and down, you see this racism, and if you walk through our prisons, it won't look like any of our communities. It will be disproportionately Black and brown people. So that's critical fact 2 that we can't ignore. And critical fact 3 is we incarcerate this huge number of people. So in 1970, there were about 300,000 people incarcerated in the United States. And in 2010 or so roughly 40 years later, there were 2.3 million people incarcerated in the United States. So this 7-fold increase in incarceration, and that is about people, maybe more prosecutions, but really what it's about is longer sentences. People serve outrageously long sentences, even for serious crimes. So there are crimes where some of us say, wait, why are people in prison for that at all? And my view of that might be more expansive than other people's. There are other crimes where we say, well, I think people should face consequences for that. I don't think that should be legal, but the consequences associated with it are still out of step with our peers in other countries, for example. So that's, I think, the Cliff Notes version of what's going on in our prisons on a good day. And then there, as I said in my kind of introduction, there's this whole overlay of how do you add in infectious disease to that horror show? And maybe Jean wants to add in on that.
Well, just 3 short things. One is just to give you a picture of Mercer County. There used to be, I'm told, about 364 people in our Mercer County jail, and that's been reduced probably through the efforts of Alex and the people from the ACLU to 312 prisoners. The other thing I think that's important for this discussion is that because of the long sentences and because of the long mandatory minimum sentences that prisoners get in the state prisons, we have 11% of the people in our prisons are elderly. And the the Bureau of Prisons thinks that an elderly prisoner is someone who's 55 and older, because living in a prison ages you faster than living in the community. So we have a lot of elderly people, and we have a lot of the health, the physical and mental health of the people in our prisons is much worse than it is in the community, without going into the details. So we have three very vulnerable populations: elderly people, people with serious mental illness, and people with a variety of serious physical illnesses. And of course, that's important with respect to COVID-19, because what we hear is if you get COVID-19 and you're old or you are ill, then you're much more likely to die. So those are the two things I would add to the snapshot. Well, one more thing is that if you look at the people in the state prison, 64% of the men and 65% of the women have pled guilty or have been convicted of violent offenses. But as Alex said, because we incarcerate people with such long sentences, that means that we have a lot of elderly people who've been in prison for most of their adult life, who committed a violent offense, say in their youth. And so now they're 55, 60, 65, 70 years old, and they are at high risk of death because of the virus.
And so what are they facing right now with the COVID crisis?
So go on, Jean.
No, they're facing illness and death, because I think the experience around the country is that, as in nursing homes, as I think Alex also mentioned, this virus is going through the total institutions like the jails and the prisons very quickly. So lots of people are getting sick. Also, of course, if you look at the DOC, the Department of Correction statistics, it seems like it's mostly employees who are getting sick. And indeed, a lot of state workers are getting sick. Maybe only a few have died, but that's a vast understatement, because many prisoners do not even, until they get very, very ill and have to be hospitalized. I think there were 10 people in hospitals as of this morning. If you have symptoms of this virus in a state prison and you allow yourself to be tested, the chances are you're going to be put in solitary confinement in either a punitive cell, or you're going to be put in I think it's East Jersey State Prison, in a unit which has been not used recently because it's so decrepit, etc. So
if I could, Liz, let me just say, I think there are three additional principal reasons why people in prisons are in such great risk. And so Jean talked about the first, the kind of baseline, which is people there tend to be more vulnerable. They've had bad access to healthcare for their entire lives. They're older, and so they have some pre-existing vulnerabilities compared to the rest of society. But there's three additional things. And I think the biggest one is that social distancing, which is the thing that we've all been told is the single best way to keep ourselves safe, is not difficult in prisons. It is impossible. These are institutions that are designed to prevent you from being socially distant. And so there are some places that are better and there are some places that are worse. There's some dormitory settings where people are packed in like sardines. There are other places where you have one roommate or no roommates, but full social distancing, the way that my family and I have been practicing it, is not possible in correctional institutions. So that's thing number one. Thing number two is that testing has been abysmal. Now, the Department of Corrections has now committed itself to a program of universal testing, but it is now May 17th, and many people still haven't been tested. And if we were gonna do this right, there would have been universal testing months ago, frankly. So perhaps we're in a good place on testing, though it is certainly late in coming. And then the third thing is the basic pieces of sanitation, a good hygiene that we've all been told we can do if we can't socially distance, have been very slow to come to the prisons. Again, they're there on most of them, but going back to mid-April, in mid-April, the Department of Corrections still treated hand sanitizer as contraband. You would still get sent to solitary confinement if you had hand sanitizer. But you can use soap. But to use soap, you need working water, right? And you can't use soap at all times. In the same way, I try to wash my hands when I can, but I don't bring my kitchen sink with me. And so if I'm outside and I need access to cleaning my hands, I use hand sanitizer. Well, you couldn't do that in prisons. Masks, they're now being provided, but it took a long time. The basic personal protective equipment, the idea that you would scrupulously clean high contact surfaces like shower handles and doorknobs and things like that is just not happening to the same extent in prisons as it is in society. And so those things together make it a really toxic environment where the death rate is so spread. And that, I think, well, I'll let you ask your next question, but I think that's why the need to act is so urgent.
Yes.
The Department of Corrections, a number of years ago, maybe a decade ago, decided that it would be better to have prisoners be in double cells together because they were concerned about suicide. And now that's become a big problem because they don't have the space to place people safely away from others. But we're told that even if prisons could be locked down, that would not keep prisoners from getting the virus because people bring them food, people bring them mail, there are people coming in and out of the prisons. So as Alex has said so well, these prisons, which are dangerous places because of abuse and poor health care to begin with, they're now death traps.
Right. So on April 10th, Governor Murphy signed an executive order recognizing these dangers and the potential for massive illness and death. And it seemed to open the door for releasing elderly, those who are infirm, those who are near the end of their sentences, etc. What happened?
A lot of bureaucracy and very slow movement. I think Alex can tell us more specifically, but it seems like hundreds of people got out of the jails very quickly after the Chief Justice ordered that they be released.
Yeah, so let me back up from Liz's mid-April and take you back to March. In March, when the virus was just starting to spread in the United States and hadn't yet plagued our prisons and jails, but everyone saw the writing on the wall and knew it was going to happen, with the Office of the Public Defender, the ACLU filed what's called an order to show cause with the Supreme Court, directly with the Chief Justice, and asked him, basically, tell us why you shouldn't just release everyone who is serving a sentence in the county jail. And we identified that group because they were necessarily serving low-level offenses. They had been given sentences of 364 days or less, so we knew none of them had kidnapped the Lindbergh baby, for example, right? These were not the crimes of the century. And we filed it on a Thursday, and on the Friday, the Chief Justice ordered us to go to mediation, and the ACLU, the Office of the Public Defender, the County Prosecutors Association, and the Attorney General's Office went into mediation with Judge Karchman, Phil Karchman, I think a Princeton resident, and a retired judge. He led us in a mediation, and Angelo Onofre, who's the Mercer County prosecutor, represented the County Prosecutors Association. And to everyone's credit, we came up with a solution that didn't quite let everyone out, but in a week's time, 697 people had been released pursuant to the order. And we think that's pretty good and reflected the urgency of the moment. We then turned our attention to the state prisons, and many organizations and people wrote to Governor Murphy and urged him to take dramatic action to reduce the population. And we talked about commutation, we talked about suspension of sentences, and we talked about furlough as three tools he could use to reduce the population quickly and dramatically. And as you said, on April 10th, which was Good Friday, he issued Executive Order 124, which created a mechanism that would potentially allow for the release of several thousand people. Unfortunately, it suffered from several limitations, including its speed, its scope, and the mechanism of its release. So on speed, where everyone thought, every day that we drag our feet, people will die, it set up a system that called for the Department of Corrections to create lists of people in an indeterminate amount of time. Then a mechanism for prosecutors and victims to object that would take at least 5 days. Then a recommendation would be made to the Commissioner of the Department of Corrections. Then he would have an additional 3 days to make a decision. So that was too slow. In fact, what we've seen is it was elongated and made much slower even than the executive order allowed. So speed was problem one. Scope was problem two. Whereas advocates had been saying, we should be releasing everyone who's got a year or less on their sentence, because if we want to allow for a modicum of social distancing in our prisons, we need to really thin this population down, and we can't drag our feet. We can't kind of waffle about how we're going to do this. Instead, what the order did is it said, we're only going to deal with people who have not been convicted of a series of violent crimes. And we're only going to, on the people approaching release, we're only going to look at people who are getting out in the next 3 months rather than the next year. So that dramatically limited the scope of potentially eligible people. And then the only mechanism it really created, other than allowing people who were already parole eligible to be paroled, was it built out this system of furlough. The idea behind a furlough is that if I were serving a sentence in state prison, I would now still be serving my sentence, but I'd be serving it from home. If I left inappropriately, I'd be charged with an escape. I had to wear an electronic monitoring bracelet. I had to call in twice a day. If I didn't call in within my half-an-hour time slot, it would be treated as an escape. And there might be people for whom that sort of very restrictive custody still makes sense because they have health vulnerabilities, but they pose some other danger. But this was the only mechanism that was created. So if I had a sentence that was due to expire on June 1st, I was going to be done with my sentence on June 1st, and they let me out today, I'd still have to go through that whole rigmarole. And in fact, if they didn't think that I had a suitable place to go where I could have access to a phone and all these things, they just wouldn't let me out. And what that has meant is not enough people have gotten out. Now, I will say, we're not sure how many people have gotten out. We filed a brief with the Supreme Court on Thursday, and the best available information we had when we filed that brief was that 99 people had been released pursuant to the order in over a month. There's now been some reporting in the governor's press conference. His chief of staff reported that the number is closer to 500 or 600. They haven't been very transparent about the numbers. We're not sure. But the best case scenario is it's not enough. And it's because of the policy choices that have been made. And the policy choice was, and I'm going to shut up in a minute, but let me just try and frame this out in terms that a democratic organization will make sense. We all know what the traditional political calculus has always been, at least since 1988, which is if we let people out of prison and they commit bad crimes, see Willie Horton, our opponents will paint us as soft on crime, and we will pay a political price for having let someone out of prison if they go and commit another crime. That's what the traditional political calculus is. But what we haven't done as advocates is made clear that there should be a political cost for doing nothing, which is to say, in the time since that executive order was signed, when some small number of people have been released from prison, 42 people have died. Right? When the governor does his press conferences, he talks about the precious souls who have died. 42 precious souls have died since the executive order was issued. And so we are not acting with the urgency that this situation demands. People are dying as a result of the speed and the scope of our response, and we need to do more. And in a minute, I'll tell you some thoughts I have on what more we can do. But I want to just reiterate, and Jean talked about that Nicholas Katzenbach quote earlier about what happens in prisons doesn't stay in prisons. But what I've been saying to people is, listen, I care about this because I don't want 42 people to die. And maybe you don't. Maybe you don't care about people in prison and you think, they did something and so whatever happens to them happens to them. I think that's callous and I think that doesn't reflect a shared vision of humanity, but fine, that's your view. Then you should care about the people who work in those prisons who are at this dramatically higher risk of infection. And if you don't care about them, then care about their families. And if you don't care about any of that, if none of that resonates with you, then care about your grandmother or your partner or your son, because when the infections explode in the prisons, people will go to hospitals. They will go to the same hospitals that your grandmother, your partner, or your son goes to. They will need ventilators, the same ventilators that your grandmother needs. And so as we talk about flattening the curve, that includes treating people in prison with the humanity that they deserve.
Thank you.
That's really beautiful, Alex. Thank you.
That's really the heart and soul of what we're trying to fight here.
So what do you think, with having tried to negotiate with the governor, having made some progress through the courts for the jail prisoners, what do you think are the most effective strategies for moving this process forward?
Took the words right out of my mouth, Jean.
Excuse me?
Took the words right out of my mouth. Thank you.
So I've got 3 thoughts, and we're pursuing all 3. Thing 1 is that while we filed this order to show cause around the state county jails, we've also filed one around the state prisons. We originally filed it on April 8th, so 2 days before the executive order was filed, but also, and this is our bad timing, right as Passover led to Good Friday. And so when the court got the order, they said, listen, we're not ordering mediation, but if you want to do mediation, we'll make Judge Karchman available on Monday. And then the governor issued the executive order and the attorney general and the county said, let's wait, let's see how the executive order goes. And if maybe we'll have to mediate later. As we watched the implementation of the executive order and were disappointed in its scope and its speed, we filed last Friday, so 10 days ago or so, we filed a letter with the court where we said, enough already. It's been a month. Give us a briefing schedule. We want to litigate this. And the court obliged and set a briefing schedule. So we filed our brief, as I said, on Thursday. The attorney general and the county prosecutors and the parole board and the Department of Corrections have their responsive brief due on Tuesday. And so we'll know a lot on Tuesday about the position they take. Are they going to say, yes, you're right, we should be releasing more people and finding a mechanism, or are they going to fight us tooth and nail? I don't honestly know. My expectation is they're going to fight, and then it'll be in the hands of the courts, and we'll see what they do. So the courts are still an option, but there are 2 other possibilities, and one is the legislature. We have floated the idea, some legislators have floated the idea, and we think it's a very good one, to create a credit that would apply to work off of people's sentences. So let me just explain. Right now, when people are in prison, assuming they don't have certain mandatory minimum sentences, if you have a 3-year sentence, you won't do all 3 years because you'll earn certain credits against it. You'll earn what's called good time credit, commutation credit, work credit, minimum custody credit, and each thing takes some amount of time off of your sentence at the back end. What the legislature could do is pass a public health emergency credit that says if you serve your sentence during a time of public health emergency, we are going to take some time off of your sentence. And there are really 2 reasons for that. The first is we need to reduce the population in prisons during times of public health emergency so we can allow for social distancing. So it would get everyone out who was going to be out within a year. It would just ease them out, creating space for the remaining, 14 or 15,000 people stuck in our prisons. So that's rationale 1. And rationale 2 is,
and Alex,
this actually has
can I just ask about that action? Have you floated this? Do you have a sense of where the legislature is on that?
There are at least some members of the legislature who are very interested in this idea. I would expect to see it moving soon. And it needs to. This is not the sort of thing that we can spend a lot of time cogitating about its pros and cons. We either do it and it helps and saves lives, or we don't do it and it doesn't help and doesn't save lives. But the other thing I want to say is related to the same legislative proposal. It's just an alternate rationale for it, which is it acknowledges that to serve time in prison in these last 2 months has been very different than the time you would have served in prison 4 months ago or 6 months ago. It's different because you face this risk of peril, you face this risk of death, you have this constant fear. And Jean read that very heartfelt statement from her client talking about the freight train coming. And it's also that you're locked in your cells 23 hours a day. And Jean alluded to this. People are not reporting symptoms at the rate they might because the conditions under which they're held are so punitive. And so if we want better reporting, we actually need to make the conditions less punitive. But so an acknowledgement that, back in the days of yore, we talked about people doing their time at hard labor. And you got kind of more credit for time you did at hard labor than just for being in prison. And it's the same thing. This is the toll that incarceration is taking in these last 2 months is fundamentally different than the toll it took in another time. And so giving these credits would kind of serve both purposes. It would be an acknowledgement of the difficulty of the time, and it would help to thin the population. So that's the legislature. We've talked about the courts. And
Let's go back to the legislature for just a minute, Alex, because unfortunately, what a relatively short credit, Corona credit, does is it leaves out all of those elderly people who have been fined for 30, 40, 50 years, who created a terrible, who were convicted of a terrible crime in their youth. It leaves them in the prisons, and it leaves people with serious disabilities who also have long sentences in the prisons. Alex talked about the fact that we have longest sentences amongst the so-called democratic nations. And so for the people who disagree with that particular strategy, we are concerned that the most vulnerable people are going to be left to die in the prisons because they're not going to get out with that credit. And the reason for that, and I think probably this follows from what Alex has said, is that politically, the governor, obviously, and some legislators don't want to be seen as letting out dangerous prisoners. Now, with respect to the elderly, we know that the elderly people from 55 or even 60 years and greater have the lowest recidivism rate of any other group in the prison system. And in fact, the rate goes down to, their recidivism rate goes down to close to either 3% or 1% by the time they're 60 or 65. So another strategy would be to try to get all of the elderly people out of the prisons. And that's 11% of the population in the state prisons. But to do that, we need either the governor to have the political courage to use his constitutional authority for executive clemency, or the legislature has to get rid of the limitations on the furloughs that right now are preventing the Department of Corrections from letting out elderly people. I just lost you. Okay. So yeah, that's another. So some people say, let's really do what's right and try to press our state officials to do the right thing, and others that say, let's just proceed incrementally. But while we're proceeding incrementally, as Alex has also said, I've lost, my computer has lost you.
We still hear
people
you.
People are going to keep dying, in short.
Right. We hear you, Jean.
So just to be clear, Jean's right. The COVID credit wouldn't, or the public health credit, whatever we call it, wouldn't focus directly on older people. It also wouldn't have a limitation based on crime of conviction. So there would be some people who would get out. It would thin the population to allow for social distancing, but I don't think anyone thinks that any of these solutions on their own solve the problem. And so really, if we do this right, what would happen is maybe the courts act and maybe they don't. Maybe the legislature creates a mechanism for getting the people who are soon to complete their sentence out and maybe they don't. But the governor also needs to go beyond Executive Order 124. Executive Order 124 was limited to using the furlough power. We need to also, the governor is empowered constitutionally to use the ability to issue executive clemency, to issue pardons, and he needs to do that for the most sick, the most vulnerable, and the elderly.
We have a question from our group asking if the administration of the executive order could be under the daily supervision of a single judge whose job is to get people out. If you had that level of oversight, would that be helpful?
So the executive order doesn't provide for that. The executive order places all that authority in the commissioner of the Department of Corrections. And I think there are lots of problems with that. And in our litigation, we talk about that. But we do effectively say, listen, courts don't lose all their power and there's still things courts can do. And if our experience in the county jail negotiation means something, it showed me that judges can take a leadership role here. And judges really did take a leadership role in saying, look, we're letting out people unless you can prove to me that they're going to be a risk to public safety. And what it meant was 697 people went home out of about 800 people who were potentially eligible. So if we had that sort of rate of release under the executive order, we'd be talking about at least 2,000 people being out of our prisons, which would really improve the public health conditions for everyone inside. So I do think something like that would be helpful. It won't happen unless the governor takes more action to empower, to take the power away from the commissioner and give it to a judge or any sort of kind of special master. Could be a retired judge, could be a respected member of the community. But right now, for whatever reason, the Department of Corrections is not acting with the speed and the urgency required for this situation.
There's one other locus of power that we haven't talked about that's really important, and it's part of why we are here, which is that there has to be community activity, not to put pressure on the governor, the legislature, and also to create a public. I'm sorry, I'm losing my command of the language.
What you're asking,
and the legislators and the governor need to know that people in the community think that what's happening is unacceptable. And we need a kind of an inside and outside strategy. We need all, as Alex, I think, has said, we need all the strategies. We need the threat of litigation. We need people to go to their legislators. And we need, one of the things that the People's Organization for Progress that I belong to, and a number of other organizations, the Coalition for Alternatives to Isolated Confinement, the American Friends Service Committee, we're having a funeral procession on May 28th at the War Memorial. At the time that the governor is giving a press conference, we're going to have a funeral procession to remember the people who've been dying while these processes through the executive order are moving so slowly. And this is something that people in Princeton and in Mercer County can really help with, which is why I sent you a flyer about it, Liz, because you're close to Trenton, where the rally will take place.
right. So we will post that on our PCDO website and put it in our action alerts so that people know to be able to join that. What are some other effective advocacy actions we can take? How can we be strategic in trying to move this quickly?
Well, one thing we can think about is that we don't have to completely invent the wheel here. In last fall, there was a report of a commission on sentencing and disposition that made recommendations that may not be immediately effective, but will help and will also actually change how the prison system works by eliminating mandatory minimums for certain crimes so that people who cannot now be furloughed could be furloughed in the future. The commission made a number of recommendations which we could press the legislature to take up. There have been legislators who have supported presumptive parole of elderly prisoners. That's another. And then, of course, we could try for presumptive parole of seriously mentally ill people who are in the prisons who could be transferred to the mental health system instead of being kept in cages. What we're talking about is seriously mentally ill people in cages, not able to visit with, hardly able to communicate with their families, and they're in cages and they're sick. And that's unacceptable.
Right. So a role that the legislature could have in early release would be legislation for presumptive parole. And any
Yes.
other roles for legislators, Alex?
Sure. So there was a really terrific piece of legislation passed several months ago called the Earn Your Way Out Act that would expedite some parole release. It had a 13-month effective date. So it wasn't going to take effect for 13 months. The legislature could speed the implementation of Earn Your Way Out. That would also get people out. Jean is absolutely correct that the Sentencing and Disposition Commission has made a series of recommendations, some of which are very good. I mean, all of which are good. They don't go far.
They're not enough.
All of which are quite, would be quite useful. And so making those into law would help ease the number of people coming in. But so first let me say, and one other thing that would help ease people coming in is, right, we're talking about getting people out. There's also, you can stop people from coming in. And so we can talk to prosecutors about exercising their discretion to not be seeking state prison, to not be seeking prosecution of certain cases where there are other solutions. And so what we've found is that since the pandemic has come to New Jersey, police officers have been much more circumspect about their arrest powers. They've been using arrest powers when it's necessary to protect public safety. So they're interceding. They're not letting people not, shoot people and do all the things that we want police to get involved in, but you're seeing fewer arrests for street level drug activity and the sorts of things that are less pernicious from a public safety standpoint. If that can become solidified and we can make that a more permanent change, that will also help reduce the number of people in. But when we talk about political might and what can we do, I mean, I have lots of things we can ask the legislature to do, but for all of us, when we're trying to build a narrative around what does a good world look like and how can we address criminal justice reform, I think one important thing to not do is what we want to avoid is saying, look, of course we should get the nonviolent drug offenders out of prison. Because let me be honest with you, that's not what prisons are, right? 65% of people are in for crimes of violence. That doesn't mean they should be in for as long as they are. And so we should resist at every turn the temptation to otherize some group of people in the prison. And I'll tell you why, and no one really knows this better than Jean, but I started my career as a public defender before I came to the ACLU. And, there are people who've done horrible things who are not horrible people. There are people who've done horrible things who I would, let come babysit my children. Not everyone, but an individualized determination about a person and what sort of supports they need to successfully be in society can't look only at the worst thing that they've ever done. And so we need to move past that. So that's why when we think about like a public health credit, a critical piece is it's got to apply across the board. It can't be just for some people. It's got to be for everyone. And remember, if we're letting people out a year early, they're getting out anyway, right? So if society isn't ready to deal with them, well, they're going to have to deal with them in a year. They're going to have to figure out how to provide that person with enough supports to make sure that they can safely reintegrate. And all we're suggesting is speeding that process.
And the the brief that you submitted on Thursday, what can we do to push that forward?
Well, that's not a place where public pressure is going to be super effective, just because and appropriately, right? Courts should be more insulated from the public. That doesn't mean that they don't know what the public thinks, but I'm not going to ask you to picket the justices' homes or anything crazy like that. But there's going to be a public discussion about it, and it's going to be a public discussion in the courts and in the legislatures and on the streets. And I think it's just important that everyone recognize that we're all in this together. And if we're talking about, how are we going to get back to normal and reopen society? It's all going to fail if we keep these huge infection spikes in our nursing homes and in our prisons and in our meatpacking plants. Because remember, the people who work in prisons are come to our community. The people who get out of prisons come to our community. So if you want to keep your community safe, you need to keep the people who live and work in prison safe. And we're failing on that account. And part of our reopening strategy has to include a strategy to drive down populations in jail and correspondingly to drive down infection and death rates in jails and prisons.
Also, Liz, one of the things that can be done by people who are not lawyers is talking to police chiefs, talking to police commissioners, talking to prosecutors, the Mercer County Prosecutor's Office. Alex probably knows more than I do about where Mercer County is on the spectrum of thoughtful changes in policy. But we could start with that. We also need to look at what's happening in our local jail, because as of last week, my godson, who is in the Mercer County Correction Center, tells me that no one is talking to them about the virus or what to do. At least the New Jersey Department of Corrections has sent out some memos saying wash your hands and do stuff like that, but not in the jail. And reading the emails that I get every day, one of the things that's obvious is that people don't know what's happening or what's going to happen, and that is causing great distress and may cause difficulties in operations, particularly when New Jersey State Prison down the block from us is losing so many of its employees. And the employees, what we're hearing is that employees disappear and then they come back, or they walk around with symptoms and no one picks them up on it. So we need to see what's happening in our own backyard, particularly the jail, more than the state prison, because we have more leverage, I think, with our county executive and mayors and stuff.
So let me just close by talking specifically about Mercer County, because Jean's point is right about the ability to kind of impact things on a local level. I think Angelo Onofre, the Mercer County prosecutor, is a really thoughtful person. I've worked with him on a lot of things, and I value him as a collaborator. We don't agree on everything, suffice it to say, but we have an ability to have a conversation. And I think one thing you can do is explain the counterbalance. There will be people who will call his office and say, how can we ever release anyone from prison? What are you doing? This is crazy. And so it would be helpful for him to hear from people who say, I hear you had a role in that jail release thing. I think that showed great leadership. Thank you for keeping us all safe by letting low-level offenders out rather than keeping them in this petri dish of the Mercer County Jail. That was good leadership, because he will be hearing that. He will be hearing from the other side, so we need him to hear from us. And it doesn't need to come with a threat, or it could just be hey, thanks for doing that. Because I think Angelo is going to always try and do what he thinks is right. But obviously, whenever there's kind of political forces and dynamics that can bring pressure to bear, he'll do it.
I want to just point out that the ACLU wrote to every single jail system in the state, talking to them about what they needed to do. And then in Mercer County, I followed up and wrote to every single politician that I could think of connected to Mercer County and said, please pay attention to what the ACLU is recommending. Nobody got back to me. That's me. But for the PCDO and for your allies, our allies here in Mercer County, we need to get back to those people and make sure that they are looking at what's happening in the jail. And you can do that together better than I can.
Thank you. It is an impossible task. We have just skimmed the surface of the depths of this issue. But Alex and Jean, you've given us so much to think about and really shed a light on what's been kind of a dark secret in our state of what's going on in the prisons. There's much for us to do, both in the short term and the long term. The immediacy is doing what we can to get prisoners out and safe. And as Alex said, making all of us safer. We will have on our webpage and on our weekly alert, different things that we can do. We have been sending, reaching out to the governor's office to push for action on his executive order. We can refine those asks per what we've heard here. We now know what we can reach out to our legislators to ask to get their involvement in making things change quickly. And on a longer scale, we all know that our world turned upside down with COVID-19. And where we come out on the other side, it will not be the same as what it was. And it will be our job to figure out how we shape that in a more fair and just way.
But it may be that our actions with respect to the prisons on this issue are going to make the prisons more humane in the future.
That's exactly what I'm speaking to in this case for, that this might be a chance to do some of that criminal justice reform that you've been working so hard on to maybe make some differences. And so watch for our action alerts. For a personal face on this, we've been looking systemically. If you want to hear some personal stories and name the names of those who have been lost, if you go to the ACLU Facebook page, there is a name their names vigil and also COVID-19 Behind Prison Walls Town Hall, where we hear individual stories of people who did not get out soon enough. Take a moment to remember them and to know that they are among the many that we are all losing in our state. Thank you so much for your time and all that you're doing. And thank you all for listening. Our hour has flown by, but the conversation will continue. Thanks to you all. And for those whose questions we did not get to, we'll forward them on to our speakers so that they can address those as well. Thank you all. Have a good night.